Imagine waking up tomorrow morning with a fever. Not just a mild one, a real one. The kind where your whole body aches, your throat feels like sandpaper, and even breathing hurts. What do? You reach for your phone. You Google your symptoms. You maybe text a friend, grab some ibuprofen, maybe call your doctor. You know there's a hospital 20 minutes away. You know there are antibiotics if things get worse. You know, deep down, that you're probably going to be fine. Now imagine none of that exists. No hospitals, no antibiotics, no painkillers, no germ theory, no hand washing, no understanding whatsoever of what disease even is. Instead, you have a doctor who genuinely believes your fever is caused by an imbalance of invisible fluids inside your body. And his solution is to drain your blood until you feel better. Or worse. Whichever comes first. Welcome to medieval England. And I need you to understand something before we go any further. You would not survive. The world you're entering. Before we get into the horrifying details of medieval medicine, let's set the scene. Because context matters here. We're talking roughly between the years 500 AD and 1500 AD, 1,000 years of history that most people have simplified in their minds into a single, blurry image of castles, knights, and people wearing burlap sacks. But the medical reality of this period was something far more specific, far more terrifying, and far more fascinating than most history classes will ever tell you. Medieval England was a world where the average life expectancy was somewhere between 30 and 40 years. And that's not because people were old at 35. It's because so many of them died young. Infant mortality was catastrophic. Childhood disease was routine. And the kind of infection that you'd shrug off with a course of amoxicillin today. In medieval England, that was a death sentence. Now here's the thing that makes this story really hit different. The people living in this world were not stupid. They were not primitive. They were not somehow less intelligent than you or I. In many ways, they were extraordinarily resourceful, deeply observant, and genuinely trying their best with the tools and knowledge available to them. The problem was not their intelligence. The problem was that they were operating with a completely wrong model of how the human body worked. And that wrong model, that single, fundamental misunderstanding, killed millions of people over centuries. So let's talk about that model, because it all starts here. The four humours, the most dangerous idea in history, meet Hippocrates. You've probably heard the name. He's the guy the Hippocratic Oath is named after. The father of medicine. Born around 460 BC in ancient Greece. Now, Hippocrates was, by the standards of his time, genuinely brilliant. He pushed back against the idea that disease was caused by angry gods or evil spirits, which, for 400 BC, was actually a pretty radical position. He tried to observe patients systematically. He wrote extensively about symptoms and treatments, but he also came up with a theory that would dominate Western medicine for over 2,000 years, the theory of the four humours. The idea was this: the human body is controlled by four fundamental fluids, or humours: blood, phlegm, yellow bile, black bile. When these four humours are perfectly balanced, you are healthy. When they fall out of balance, when you have too much of one, or not enough of another, you get sick. It sounds almost reasonable when you say it out loud. Almost. But let's follow the logic to where it actually leads, because this is where things get dark. If you believe that disease is caused by an imbalance of humours, then the logical treatment for disease is to rebalance those humours. Got too much blood? We drain some. Got too much phlegm? We give you something to make you vomit. Got too much yellow bile? We give you a laxative. And this single intellectual leap became the foundational logic of European medicine for more than 2,000 years. Now, The Romans adopted the four humours theory from the Greeks. Then the medieval Europeans inherited it from the Romans. And they didn't just keep it. They expanded it. They built an entire cosmological system around it, linking the four humours to the four seasons, to the four elements: earth, air, fire, and water, to the position of the planets, and even to your personality type. Blood equals spring equals air, equals sanguine personality. Phlegm equals winter, equals water equals phlegmatic personality. Yellow bile equals summer equals fire, equals choleric personality. Black bile equals autumn equals earth equals melancholic personality. It was elegant. It was internally consistent. It was taught in universities. It was written into law. It was completely catastrophically wrong. But here's the thing about an elegant wrong theory. It's extraordinarily hard to dislodge. Because when the treatment works, you credit the theory. And when the patient dies, you say the imbalance was just too severe. Or you blame the patient for not following the regimen correctly. Or you blame the position of Saturn. You never, ever question the theory itself. And so, generation after generation, medieval English doctors, called physicians, trained under this framework. They memorized it. They believed in it. They staked their reputations on it. And they practiced it on hundreds of thousands of sick, suffering, terrified patients, with predictably catastrophic results. Who was your doctor? Here's your first surprise about medieval medicine. Most sick people in medieval England never saw a university-trained physician at all. Because physicians were expensive. I mean seriously expensive. If you were a wealthy merchant or a minor noble, maybe, you could afford a physician's fee. But if you were a farmer, a craftsman, a soldier, or a servant, which is to say, if you were literally anyone in the vast majority of the population, you were getting your healthcare from someone else entirely. You had three options. Option 1, the apothecary. The apothecary was essentially the medieval pharmacist. They sold herbs, compounds, and remedies, some of which were genuinely useful, some of which were completely inert, and some of which were actively poisonous. The apothecary didn't diagnose you exactly, but they'd sell you something for what ailed you based on their knowledge of herbs and their understanding of humoral theory. Willow bark, which contains salicin, the compound that aspirin is derived from, was used by apothecaries and herbalists for pain and fever. That one actually worked. But for every willow bark, there was a remedy that involved drinking a mixture of wine, vinegar, and powdered animal bone, or applying a paste made from earthworms and pig fat to a wound, or eating a spider wrapped in butter to cure a fever. Option 2, the barber-surgeon. Oh, this is where things get truly wild. The barber-surgeon was, in medieval England, perhaps the most important medical professional for ordinary people. And yes, the same person who cut your hair also performed your surgery. This is not a joke. The red and white striped pole you still see outside barbershops today, that's a direct reference to the barber-surgeon's trade. The red represented blood. The white represented the bandages. The pole itself was what patients would grip during procedures, partly for stability, and partly to make their veins bulge so the surgeon could find them more easily. Because the barber-surgeon's primary medical intervention, his signature move, the hammer in his toolbox, was bloodletting, phlebotomy, venesection, bleeding. The idea that you could cure almost any illness by draining blood from the patient's body. Headache, bleed the patient. Fever, bleed the patient. Plague, bleed the patient. Too energetic, bleed the patient. Not energetic enough. Also, somehow, bleed the patient. The logic, remember, was humoral. If you had too much blood, or if your blood had become corrupted, you needed to remove some. The barber-surgeon would open a vein, usually in the arm, neck, or behind the knee, and drain out a measured quantity of blood into a bowl. How much blood? Well, the theory suggested it should be enough to restore balance. In practice, this often meant draining enormous quantities. There are historical records of physicians draining multiple pints of blood from already sick patients in a single session. To put that in perspective, the average human body contains about 10 to 12 pints of blood. Losing just 2 to 3 pints, roughly 20 to 30% of your total blood volume, puts you into hypovolemic shock. So, you came in with a fever. You left with a fever and life-threatening blood loss. This was considered good medicine. Option 3, the wise woman or local herbalist. In villages across medieval England, there was almost always someone, usually a woman, usually older, who had a reputation for healing. She knew which herbs grew in the local fields. She knew the old remedies passed down through generations. She might have genuine skill at setting broken bones, midwifery, wound care, or treating burns. This person was, in many cases, actually more effective than the trained physician, not because she understood germ theory, but because her treatments were often herbal, and therefore at least inert, if not occasionally beneficial, and crucially, she was less likely to actively kill you by draining your blood. However, if she was too effective, if her healing seemed inexplicable, if her patients recovered when they shouldn't have, she might find herself accused of witchcraft. So even the best option came with a serious downside. Now let's talk about actual diseases, okay? You understand the medical system, or rather, the catastrophic lack of one. Now let's talk about what was actually killing people, because this is where the video really earns its title. The plague. Let's start with the big one, the one that everyone knows about. Because if you lived in medieval England between 1346 and 1353, your odds of being alive at the end of that 7-year period were roughly 50-50. The Black Death, caused by the bacterium Yersinia pestis, arrived in England in 1348, most likely via merchant ships from continental Europe. It spread through 3 mechanisms: flea bites, bubonic plague, respiratory droplets, pneumonic plague, and direct blood contact, septicemic plague. Bubonic plague, the most common form, caused the swelling of lymph nodes into painful, blackened lumps called buboes, usually in the armpits, neck, or groin. These could grow to the size of an egg or even an apple. They were agonizing. They often burst, releasing fluid and blood. Without antibiotics, bubonic plague killed roughly 30 to 60% of those infected. Pneumonic plague, which infected the lungs, was essentially a death sentence. Mortality rate without treatment, close to 100%. And medieval England had absolutely no idea what was causing it. The explanations offered at the time included miasma, bad air, the conjunction of Saturn, Jupiter, and Mars in 1345, God's punishment for human sinfulness, and, horrifyingly, Jewish people poisoning the water supply, which led to horrific pogroms across Europe. None of these explanations were correct. None of the treatments derived from them worked. The actual treatment for the Black Death in medieval England included lancing the buboes with knives to drain them, which sometimes provided temporary relief, but more often spread infection. Applying warm poultices to the buboes made from butter, onions, and garlic. Bloodletting, of course, drinking vinegar. Sitting in a sewer on the theory that one smell could cancel out another. This is real. Some physicians genuinely recommended this. Flagellation. Literally whipping yourself publicly as penance to God. Running away. This was actually the most effective strategy available, and the wealthy who could flee their cities did statistically better than those who stayed. By the time the first wave of the Black Death passed, England had lost somewhere between 1/3 and 1/2 of its entire population. Some estimates suggest 25 million people died across Europe in just a few years, and they had no idea why. Sweating sickness. If the Black Death is the famous one, the sweating sickness is the terrifying one, because it was fast. Appearing in England in 1485 and returning in deadly waves until 1551, the sweating sickness, cause still debated by historians, possibly a hantavirus, could kill a healthy adult within hours of the first symptoms appearing. The symptoms began with sudden intense cold and shivering, then shifted rapidly to burning fever, profuse sweating, heart palpitations, headache, and delirium. And then, in many cases, death, sometimes within 3 to 6 hours of feeling the first chill. Imagine feeling fine at breakfast and being dead by dinner. The contemporary description from one English chronicler captures it perfectly. People who were merry at dinner were dead at supper. The sweating sickness seemed to target the wealthy and the young, unusual for a medieval epidemic, which typically hit the poor and the very old hardest. This made it particularly terrifying to the ruling class, who were accustomed to disease being something that happened to other people. Henry VIII was absolutely terrified of it. During the 1528 outbreak, he reportedly fled from location to location across his kingdom, trying to stay ahead of the disease, writing frantic letters to Anne Boleyn when she fell ill. She survived, and dissolving his court to avoid contagion. The treatment, rest, warmth, and here's a genuinely interesting detail. Physicians were told not to bleed patients with the sweating sickness, because they noticed, empirically, without understanding why, that it made things worse. This was one of the rare moments when medieval medical observation actually contradicted the theory. But there was nothing else to offer. No antiviral, no supportive care beyond keeping the patient warm and hydrated. You either survived it or you didn't, and medicine had absolutely nothing to do with which outcome you experienced. Leprosy. Leprosy, caused by the bacterium Mycobacterium leprae, was endemic in medieval England. And the way medieval society responded to it tells you everything you need to know about how disease was understood. Because leprosy was widely considered to be God's punishment for sin. Specifically, sexual sin. Leprosy was associated with moral corruption, with licentiousness, with contact with sinners. The practical consequence of this belief was devastating. A medieval person diagnosed with leprosy, the diagnosis often made by a priest or bishop, not a physician, was subjected to a ceremony called the Missa pro leproso, or the Mass for a leper. During this ceremony, they were symbolically declared dead. Dirt was sometimes thrown on their head from a shovel. They were given a bell, a cloak, and a begging bowl. Then they were expelled from their community. Permanently. They were forbidden from entering churches, markets, mills, taverns, or any public space. They could not touch food items before buying them. They could not speak to healthy people except from downwind. They had to rattle their bell to warn people of their approach, and this would go on for the rest of their lives, which, with untreated leprosy, could still be decades. Now here's the bitter irony. Leprosy is one of the least contagious diseases known to science. The vast majority of humans, around 95%, are naturally immune to it, even with prolonged exposure. The stigma, the exile, the destroyed lives, all of it was wildly disproportionate to the actual public health risk. But when you have no science, you fill the void with fear. And fear in a medical appointment actually looked. Let's make this personal. Let's say you're a moderately prosperous merchant in London in the year 1300. You've woken up with a high fever, severe headache, and pain in your joints. You're genuinely scared. So you send your servant to fetch a physician. He arrives. He's wearing long robes. He has a university degree. From Oxford or Cambridge, or perhaps from a European university like Bologna or Paris. He has studied for years. He is, by every contemporary measure, a professional. The first thing he does is look at your urine, not just glance at it. He examines it carefully, in a special flask called a Jordan, designed for this purpose. He holds it up to the light. He notes its colour: pale yellow, bright yellow, dark amber, reddish, cloudy. He notes its consistency. He may smell it. He may, in some traditions, taste it. This practice, called uroscopy, was the cornerstone of medieval diagnosis. The colour and character of urine was believed to reveal the state of the patient's humours and internal organs with great precision. Urine charts were created, elaborate illustrated wheels showing dozens of urine colours and their corresponding diagnoses. Pale and watery, too much phlegm, dark and concentrated, too much black bile, red tinged, blood in excess, possibly fever. After examining your urine, the physician may also check your pulse, not to count its rate, but to assess its quality. Was it hard or soft, fast or slow, regular or irregular? Each of these qualities corresponded to humoral states. He may ask about your diet. When did you last eat? What did you eat? How much wine have you consumed? He may consult an astrological chart, because the positions of celestial bodies were considered medically relevant. Certain days were considered critical days during illness, when the body was more or less receptive to treatment, governed by planetary cycles. Then he gives his verdict. Based on your urine colour, your pulse, your symptoms, your astrological chart, and his assessment of your humoral balance, he concludes, you have an excess of blood, likely corrupted by bad air, and an imbalance of heat. The treatment is immediate bloodletting, followed by a restricted diet of gruel and broth for several days, a purgative medicine to clear the bowels, and avoidance of meat, wine, and physical exertion until balance is restored. The barber-surgeon is summoned. He opens a vein in your arm. You watch perhaps a pint of your blood drain into a bowl. You feel worse. The physician nods. This is expected. The process takes time. Over the next 3 days, if your fever breaks naturally, as many fevers do, because your immune system is actually fighting the infection, you will recover. The physician will credit the treatment. Your faith in the system will be reinforced. If your fever doesn't break, if your immune system can't manage it without support, you will probably die. The physician will say the imbalance was too great. He'll suggest that perhaps the bloodletting wasn't performed quickly enough, or that you had hidden sins that prevented the humours from rebalancing. In either case, he will be paid. He will move on to his next patient, and the theory will remain intact. The things they didn't know. Let me give you a specific list of things that people in medieval England did not know. Things that feel so obvious to us that it's genuinely hard to put yourself in their position. They did not know that germs exist. The germ theory of disease, the understanding that many illnesses are caused by microorganisms like bacteria, viruses, fungi, and parasites, wasn't established until the 1860s and 1870s, when Louis Pasteur and Robert Koch demonstrated it conclusively. Before that, no one knew. Not medieval doctors, not Renaissance doctors, not the physicians of the 1700s. The implication of this is enormous. If you don't know germs exist, You don't know that hand washing prevents disease. You don't know that sterilizing instruments before surgery matters. You don't know that the same person treating one sick patient shouldn't immediately touch another without cleaning up first. Medieval surgeons routinely operated with unwashed hands and unwashed instruments, not out of laziness or negligence, because they genuinely didn't know it made any difference. They did not know how blood circulation works. William Harvey didn't describe the circulatory system. The heart as a pump, blood flowing continuously through arteries and veins in a closed circuit, until 1628. Before Harvey, the dominant belief was that blood was produced in the liver and consumed by the body's organs, with the heart acting as a sort of furnace to heat it. This meant that bloodletting wasn't just theoretically justified, it seemed mechanically sensible. If blood was constantly being produced by the liver and consumed by the organs, removing some was just relieving pressure in the system, like draining water from an overfull bucket. It took someone of Harvey's genius and courage to demonstrate that the entire framework was wrong, and even then, the medical establishment resisted his findings for decades. They did not know that infections could be treated with drugs. Antibiotics weren't discovered until Alexander Fleming observed penicillin mold in 1928, and they weren't available as a treatment until the 1940s. This is the one that really gets me when I think about it carefully. Because in medieval England, the infections that killed people were often simple bacterial infections: strep throat, wound infections, pneumonia, urinary tract infections. Any of these, treated with a course of modern antibiotics, would have been resolved in days. Without antibiotics, a simple cut that got infected could become sepsis. Sepsis could kill a healthy adult within days. And this happened routinely, constantly, without anyone understanding why or having any means to prevent it. They did not know that childhood diseases were preventable. Smallpox, measles, whooping cough, diphtheria, scarlet fever, tuberculosis, typhoid, cholera. In medieval England, these diseases moved through communities, and especially through children, with terrifying regularity. Vaccination didn't exist until Edward Jenner's work with smallpox in 1796. Before that, exposure to these diseases in childhood was simply expected. Parents routinely expected to lose children. Graveyards in medieval England are full of small bones. The emotional weight of that is hard to fully comprehend. Loving a child while knowing, in the back of your mind, that there was a better than average chance they wouldn't live to adulthood. The hospitals that weren't medieval England did have hospitals. You might be thinking this changes things. It doesn't, not in the way you'd hope. The word hospital comes from the Latin hospes, meaning guest or stranger. Medieval hospitals were, fundamentally, places of charity, not places of medicine. They were run by the church, by monasteries, convents and religious orders, and their primary purpose was Christian charity, providing shelter, food, and spiritual comfort to the sick, the poor, the elderly, and the dying. St. Bartholomew's Hospital in London, still operating today, making it one of the oldest hospitals in the world, was founded in 1123 by a monk named Rahir. It was staffed primarily by monks and nuns, not physicians. The care provided was food, warmth, a bed, prayer, and basic wound dressing. What it didn't provide: anything that would actually treat your disease. The beds in many medieval hospitals were shared, multiple patients to a single mattress, regardless of what disease they had. Infection control was non-existent, because the concept didn't exist. If you were admitted with a broken leg, and the person next to you had tuberculosis, Your odds of leaving the hospital with tuberculosis were meaningfully elevated. There's a genuinely dark irony here. For many patients, the hospital was probably more dangerous than staying home. But the church's role in medicine wasn't purely harmful. Monastic gardens grew medicinal herbs that formed the basis of herbal remedies used across England. Monks and nuns copied ancient Greek and Arabic medical texts, including Hippocrates and Galen, and preserved them through the early medieval period, when much classical learning might otherwise have been lost. The monastery was, in a real sense, the library of medical knowledge, however flawed that knowledge was. The things that actually worked okay. I want to be fair here, because medieval medicine wasn't entirely wrong. There were genuine successes, things that worked, often for reasons medieval practitioners didn't understand, but worked nonetheless. Herbal medicine. Many of the plants used by medieval herbalists contained genuinely active compounds. Willow bark for pain and fever, foxglove, the source of digitalis, for heart conditions, garlic, which has genuine antimicrobial properties, honey, which was used as a wound dressing and is, remarkably, an effective antibacterial. Opium-derived preparations for pain relief. Some of these were genuinely effective. Wound care. Medieval surgeons, particularly those who served on battlefields, developed real skill in treating wounds. They knew how to pack wounds, how to apply pressure, how to perform amputations cleanly enough that patients survived. Without understanding why cleanliness mattered, some surgeons nevertheless adopted habits of washing wounds with wine, which is mildly antiseptic due to its alcohol content, that improved outcomes. Quarantine. Medieval authorities, confronted with the Black Death and other epidemics, developed the practice of quarantine, isolating sick individuals and placing arriving ships under observation before allowing them to land. The word quarantine itself comes from the Italian quarantina, meaning 40 days, the period Venetian authorities required ships to wait before docking during the plague years. This practice, developed without any understanding of germ theory, was nevertheless epidemiologically sound. It worked, not perfectly, but meaningfully. Triage. Medieval battlefield surgery involved a form of triage, making rapid decisions about which patients could be helped and which could not. This pragmatic approach to mass casualties is a genuine medical skill, and medieval military surgeons developed it out of sheer necessity. These successes matter. They remind us that even within a deeply flawed paradigm, smart, observant, caring people found ways to help. But they were islands of effectiveness in an ocean of catastrophic misunderstanding. The personal cost. I want to bring this back to the personal level, because statistics are easy to dissociate from. Numbers are clean. 25 million dead from the Black Death is a number. It doesn't bleed. So let me tell you about what it actually meant to be sick in medieval England on a human level. You wake up with a fever. Your family gathers around you. They're scared. Of course they're scared, because they've seen what fever can do. They've buried children. They've watched neighbours die within days of first showing symptoms. If you're lucky, there's someone in the village who knows something about herbs and remedies. She makes you a tea of elderflower and willow bark. She puts a cool cloth on your forehead. She watches your breathing. If you're religious, and you are, because everyone is, because the church is the central organising institution of your entire world, you pray. You receive last rites from the local priest, not because you're expected to die, but because you might, and it's better to be prepared. The priest prays with you, anoints you with oil, hears your confession. Your family doesn't sleep. They take shifts, staying awake through the night to monitor you. They watch the colour of your skin, the rhythm of your breathing, the dryness of your lips. They're reading signs they don't entirely understand, looking for patterns they've seen before. In the morning, if your fever has broken, if your body's immune system has done its job and fought off whatever bacterial or viral assault it was facing, there is relief that is genuinely difficult to describe. Pure, physical relief. You've survived. This time. If the fever hasn't broken, if it's climbed, if you've become delirious, if you've stopped being able to swallow, then the calculus changes. The family begins to think about practical things. Who will inherit the farm? Whether the priest needs to be called back. How to get the body to the churchyard. This was not unusual. This was not exceptional. This was the texture of ordinary life in medieval England. Every winter, every summer, every generation. We have been separated from this reality by barely 4 or 5 generations of modern medicine. What this tells us. Here's the thing I want you to take away from this video. Not just the horror, the gory details, the wild facts, though those are all real and they matter. The thing I want you to take away is this. The people of medieval England were not stupid. They were not savage. They were not failures of human evolution. They were us, the same species with the same emotional depth, the same capacity for love and fear and hope and ingenuity. They were just operating in profound darkness about how the human body worked. And the question that should make you a little uncomfortable, the question that, if you're honest, ought to land with some weight, is this. What are we wrong about right now? What assumption? What theory? What deeply embedded belief in our current medical or scientific understanding will people look back on in 200 years and find as baffling and tragic as we find the 4 Humours? We don't know the answer to that question. By definition, we can't. But the people of medieval England didn't know they were wrong either. They had no idea. From inside the system, it made perfect sense. It was internally consistent. It had authority and tradition behind it. It was taught in universities. History has a way of humbling the present. The difference between them and us isn't that we're smarter. The difference is that somewhere in the chain, Vesalius, Harvey, Pasteur, Lister, Fleming, someone had the courage to look at the evidence that didn't fit the theory and say, what if the theory is wrong? That's the story of medicine. Not a straight line of progress, but a series of painful, often resisted revolutions in understanding. Each one opposed by people who had built careers on the old model. Each one eventually, slowly, grudgingly, accepted. You are the beneficiary of every one of those revolutions. The next time you take an antibiotic, the next time you walk into a hospital and believe, in your bones, that they can help you. Remember the barber-surgeon with his bowl. Remember the physician with his urine flask. Remember the patients who survived by luck alone, and the ones who didn't. And be grateful. Because the margin between their world and yours is thinner than you think. And if this video made you see the world, or your medicine cabinet, just a little differently, do me a favour. Hit that like button. It sounds small, but it genuinely helps more people find this content. And honestly, stories like this deserve to be heard. And if you're new here, if this is the first time you've stumbled onto this channel, subscribe. Because we do this every week. We take the parts of history that your textbooks glossed over, and we go deep. The stuff that's shocking, the stuff that's human, the stuff that actually matters. You don't want to miss what's coming next. Stay curious, stay healthy, and I'll see you in the next one.